he also had a mystery beeping sound coming from his home that his wife could not locate. And his wife has normal hearing. He had just gotten out of the shower, and he goes back into his room and puts his hearing aids on and cranks them up to the top, and he found out where the mystery beeping was coming from when she couldn't. Awesome. And he was like, now I feel like I have bionic hearing.
Hey guys, welcome back to the Dr. Cliff Show. I'm Cliff Olson, Doctor of Audiology and founder of Applied Hearing Solutions in Phoenix, Arizona. And I am joined here once again today by my co-host, Dr. Rachel Cook. Dr. Kelsey Beck, welcome back to the show.
Thanks.
All right, so today we really wanted to talk about this idea of interesting patients that we've worked with, either from a perspective of they had really good treatment outcomes that we weren't expecting, or really bad treatment outcomes that we weren't expecting. And the whole reason for this is because I recently had a case of a patient that I did not expect that they would get as good of a treatment outcome as they got. And I even told them during the consultation that I'm like, listen, I do not think that you're going to be able to do what you want to do from a hearing perspective, even if you get the newest, latest, and greatest hearing aids. And they just recently came into my office this week for their first follow-up. And I had someone with a signal-to-noise ratio loss score of 18 decibels.
Wow.
Okay. Now, for individuals who are not familiar with the SNR loss tests that we do, we derive this score based off of the QuickSyn. The QuickSyn is a test where you get presented sentences. You have to repeat those sentences back to us, but there's escalating background noise with each sentence, so it gets harder and harder. And then eventually everybody breaks on that test.
Yeah.
You could have someone with completely normal hearing, even completely normal hearing and background noise, and at some point they will not be able to understand the words of the sentences. And then the scoring goes from a 0 up to a 26. The lower the score, the better. The higher the score, the worse that you did. And, I'll just kind of give an understanding here. Someone with normal hearing can typically score between 0 and 3 decibels on that scale, meaning they only need about a 0 to 3 decibel separation of the speech from the background noise before they can understand what someone is actually saying to them. And someone, let's say, who has a 10 dB or 10 decibel signal to noise ratio loss score, what that means is that they need a 10 decibel separation of the speech from the background noise before they can understand what someone is saying. Now, most hearing aids, if you're someone with hearing loss and you need to restore some missing sounds to help you out in background noise, if you have a score that's less than 10, we would reasonably expect you to wear a pair of hearing aids that have been fit and programmed properly and go into a noisy environment and be able to function relatively well. You start going above 10 decibels, that's where things get a little bit trickier.
Yeah.
I see.
Because even the best hearing aids in the world can give you, we'll say, based on the data that we have now, between 11 and 13 decibels. There's some debate as to what that really means, but 11 to 13 decibels of signal-to-noise ratio improvement. So theoretically, if you are someone who has an 11 decibel signal-to-noise ratio loss score and you wear one of those hearing aids and they're optimized settings for speech and noise, you should be able to shrink that number down to 0. Right? Well, what happens though when you have someone who has an 18 decibel signal-to-noise ratio loss score and you put them in one of these hearing aids?
Not anything usually all that great. Typically, if you're trying to only wear a set of hearing aids and you go into background noise with that 18 decibel score, you're not going to really do all that well, because really what that would leave you, like, let us just say that it does, the hearing aids themselves do drop it down, let's just say by 10, because for the ease of math, right? You still need, even with that, you would still need somebody to talk 8 decibels louder than the background noise for you to be able to hear them very well. 8 decibels louder than the background noise is perceptually almost double the amount of the background noise. And most people cannot sustain that for very long, especially when you're going into these noisier restaurants that have lots of music playing, things like that. The good news, though, is that if that individual is willing, they do make accessories for hearing aids. So things like remote microphones. So you could actually pair an extra microphone to the hearing aid. Someone else clips that microphone to their shirt. Their voice now only has to go to that microphone, and then Bluetooths all the way into your hearing aids. So you typically do need some extra assistance with that kind of a score above and beyond what a hearing aid alone can actually provide.
And this is something that I shared with this individual when he came in for his consultation. I'm like, listen, you have an 18 decibel signal to noise ratio loss score, which means as of right now, we need to be able to separate speech from the background noise by 18 decibels, which is huge.
Yeah,
and I'm like, the only realistic way that we're going to be able to get you to function again in a noisy situation is to get you one of these assistive listening devices. And at that point in time, he's like, well, let's just see how I do with the hearing aids. And I'm like, okay, I want to make sure I'm setting realistic expectations here. I don't expect you to be an all-star performer in background noise with an SNR loss of that high. And so I ended up fitting this individual, just happened to be with the new Sphere Infinio hearing aids, and gave him his spheric speech and loud noise program. I maxed everything on it. Fortunately, this individual allowed me to put him in custom ear molds, which really enhanced the effect of that to try to get as much of that signal to noise ratio improvement as humanly possible. And that's what we did. Turned him loose. Last thing I said, it's like, okay, well, go to a noisy restaurant, but don't be mad at me if you're not hearing the way that you want to. The dude comes back a week later and he's like, I could hear fine in the restaurant. Noise didn't bother me at all. In fact, when he switched into the spheric mode for optimal speech understanding and noise, he reported that even though he didn't notice that the background noise dropped down a ton, he noticed that the speech information that he was getting, or the sound that he was getting speech-wise from the people at his table and even his female server, was enough of a separation for him to actually function.
Wow.
And it's just crazy to see that, we try to prepare people as much as humanly possible for what the realistic expectations should be in the real world, because if we don't, what happens?
Then they come back angry.
Yeah.
Yeah, and I don't want them to be mad at me.
Yeah.
They might be mad at me for other reasons, but I don't want
Be
to
mad at me for any other reason, in fact.
Exactly. I just don't want to make it seem like I'm misleading them into you're going to get a certain level of performance when we're not really sure if you can. But it's totally changed my perspective. I mean, back in the day when I had mild level hearing losses, I don't want to say discounted them, but I'm like, listen, you're not really going to get benefit from a hearing aid perspective. And then I went through my whole me having vision loss difficulties, and every optometrist I go to see, they're like, you don't have enough vision loss to warrant getting glasses. And I'm like, but it's driving me crazy.
Yeah.
And then when I get glasses, I'm like, this is so much better. Like I can just see much easier. I'm not stressed out about it. And so it's changed my perspective on what's actually possible, and then what I should be recommending to patients.
Yeah.
And you actually have an interesting
I was
story
going to say, along the same lines as that, I saw an individual for just a hearing test. She reported absolutely no difficulties hearing, really didn't have any reason to suspect that she had any kind of hearing loss. She came in because her husband was actually seeing you, and so she just wanted to make sure that her hearing was okay. So while he was in for one of his follow-ups with you, we just did a very quick hearing test, and we found just a mild hearing loss across all of the frequencies that we test, so a flat mild hearing loss. And, we were having this discussion surrounding, the extra taxing that it does on the brain and how it does change how the brain was designed to function into a way that it wasn't designed to function. And that's why we're seeing, even with a mild hearing loss left untreated, we are seeing increased risks of cognitive decline, dementia, things like that. And so, she made the ultimate decision, well, even though I'm not perceiving any difficulty, I want to make sure, of course, that my brain stays healthy long term, which kudos to her, because that's not often the stance that people do take. And we fit her with her devices, and she was absolutely blown away. She had absolutely no understanding of what she was missing because she was missing it, right? And so just her first week follow-up, she's like, I didn't realize how hard I was actually working to go to a restaurant with my friends. Like, I was hearing what they were saying, but she was also having to watch facial cues, make sure she had the context of the conversation. She was asking for some repetitions just to make sure that she was correct in what she was hearing. And more often than not, she was. Again, she's cognitively strong, she's younger, she, can fill in those gaps pretty easily. But she went to that first restaurant during her first week, and she was reading her menu and not watching the mouths of the other people that she was with, and she could just hear. There was no extra, cognitive load. There was no extra effort that she had to put in. She just got to use her ears the way that they were designed to be used. And that in and of itself was just astronomical, because, of course, I, as the provider, know that, even with that mild loss, you miss things like tone of voice and intonation and the rhythm of the conversation, which doesn't sound like it has a lot of information, but it does, right? And so that was a really cool experience that, I knew she would get some benefit, but for her to come back and say, genuinely thank you for going through this with me, because she wouldn't have even suspected it had we not.
Yeah. It's kind of interesting because individuals who are cognitively strong, they can work their way through those situations. But it's almost like they don't even realize how much extra effort they are putting into it. And like you mentioned, this whole idea of slowing down the rate of cognitive decline, like we know that brain changes happen with untreated hearing loss, and it overly taxes the frontal cortex instead of being in the auditory cortex where it belongs. And so from a long-term perspective, she's going to be much better off getting it taken care of now rather than waiting for another 5 to 7 years for that mild level hearing loss to turn into a moderately severe to severe level hearing loss.
Exactly. Well, the other piece of all of that too is that even if she had waited, right, because she's done all of the adaptation now, even if things in her hearing do change later, this is already her version of normal hearing. So if we have to add in more amplification, we're not starting from scratch. She already knows how they're going to sound, and it's just now keeping up with it, right? So because oftentimes if you do wait that extra time, just getting used to how it sounds is so much harder.
Right.
So doing something as early as possible is always the best option.
Now, we've had some patients who've treated their hearing loss early, and they've had hearing aids for, 4 to 5 years at this point. And then, obviously we have new hearing aid releases that come out all the time, and certain features that are better than we've had in hearing aids in the past. And it comes down to a time where someone needs to consider upgrading into the next technology. But, considering the cost of treatment, it's not like treatment's free, at least not unless you live in a different country, where it's included as part of your national health care. But even then, the devices that they're dispensing on the national programs are not the highest tier technologies, don't have all the best features inside of them. But, we run into these discussions of, like, does it make sense to upgrade into newer technologies? And, does the benefit justify the cost? And Dr. Cook, you had an interesting case of this here fairly recently.
Yeah, literally just did a first follow-up yesterday where this came up. This individual had been in, I think we're just going to keep talking about Phonax today, but it's just because it's what's like on our minds. This individual was in Phonak hearing aids that were approximately 5 years old, still functioning devices. So, we do diagnostic testing on hearing aids every single year, and they're still functioning. But based on his couple of reports at some of his follow-up visits that he had, he just wasn't getting quite the performance out of them that he was looking for. And he knew that there had been some considerable upgrades and changes to technology over the last few years. So he kind of was in this little dilemma of, I know that I want new tech and I know that new tech is available, but do I want to spend all this money on upgrading, right? And without being able to hear it and experience it for yourself, there's no real way to know, right? So we put all of our patients through a new technology fitting sequence in our office, which consists of, a very thorough fitting appointment and several follow-up appointments to ensure that they're sounding just right. And so this was only his 1 week follow-up. And he came in and he could not stop talking about how much different it was and how happy he was. And this was someone who was set up very well with his prior hearing aids. So truthfully, me being the person who fit those hearing aids to him and then fitting him with new devices, I followed the same exact protocol. So I know that this is not a person off the street who I'm grabbing from someone who does not follow best practices, going, your devices are broken, they're not set to your prescription, like all of these things where I'm like, me fitting you correctly is what's going to make the difference, right? In this case, I did the same thing that I did previously, and he was mind blown. Like, we didn't make a single adjustment to his devices, which I feel like never happens, but it's happening more recently. And just he went on and on and on about what an incredible investment that really was. One thing that he said in particular was being able to hear the gravel under his feet when he was on a walk. He also had a mystery beeping sound coming from his home that his wife could not locate. And his wife has normal hearing. And he said that he had just gotten out of the shower and he goes back into his room and puts his hearing aids on and cranks them up to the top. And he found out where the mystery beeping was coming from when she couldn't.
Awesome.
And he was like, now I feel like I have bionic hearing. And, so it's just like really cool when you follow all the right steps, but then you also have this new technology that really outpaces what was available previously.
And that really goes to as well, not every new generation of technology is that same kind of jump either, right? So, just from, we talked a little bit about Phonak just now, but even from their last generation to this generation, that was even a really big jump. Typically, one generation to the next is not something where you'll actually hear a difference in how you're hearing. And so it might not make sense, necessarily to upgrade, every year, even, after 2 generations. But every now and again, we do get something that does blow the previous one out of the water, and it does really become worth it. Or you do, again, get enough generations out where that investment, even if you do the exact same thing, the technology catches up with what we want it to be able to do.
The thing is that the patients will never lie about it either, right? Like, you might be like, yeah, it's time for you to upgrade. They upgrade and they're like, it's better, I think, or I like this feature, or I like this feature. But they're never going to be like, wow, if it's not wow.
Exactly.
So the fact that we have people that are going like, wow, I'm like, okay, all right.
But it makes me question like our value, because my whole premise from starting in this profession is that like the technology doesn't matter, the provider who fits it is what really matters, because we're the ones who are optimizing it for you. And then you go from this, well, I'm the one who fit and programmed this person with their older hearing aids. I followed the exact same protocols that we follow, best practices to a T. And then you're like, well, the only way to possibly enhance this is to go to new technology. And then that new technology results in a better outcome. You would expect that for 3 to 4 year old devices. You would not expect that from one generation to the next. And we've seen people go from the Lumity, or at least for Phonak anyway, the Lumity into the newer tech from Phonak, the Sphere, and they've noticed a significant improvement.
But think about it this way though, right? If you had fit the Lumity, right, to their prescription, best practices, did everything by the book, and just did a first fit on the newest devices, right, and just did what the computer told you to, didn't match their prescription, didn't do real ear verification, I guarantee you they're still going to like their Lumities better.
That's
right?
true.
So it still matters a lot of who is actually doing that fitting, because anybody can realistically hook up an audiogram to the software, pair a pair of hearing aids and say, okay, here you go. But if you're not going to take the time to do just that first step correctly, you really don't even know what the rest of it could do, because, they could come back and say, well, background noise was difficult and you increase the noise reduction, but because they're not meeting their prescription, that wasn't even the thing that was going to fix the problem, right? So it still completely matters who's doing it. And beyond that, not everybody can always afford to upgrade. So I actually had a patient who definitely needs cochlear implants. Through and through, should not still be in hearing aids, but just for a lot of reasons does not want to go through it. Fine, that is her personal choice. But she comes to me and she's got, old low tier level of technology Phonaks, old low tier, 2 pairs of old low tier level Oticon devices, a pair of old Resounds, because people had been gifting her all their old hearing aids. Because she financially has never been able to afford her own devices. And, she's gone to several providers with all of these and said, can you make one of these work, right? And all of them are fit to first fit, right? And so, we're talking the ones we settled on using, because they were the ones that were functioning properly, were 4 generations old of Oticon, right? And for that significant of a hearing loss, of course, I know that the newer tech could still do a lot better. it's never going to be perfect because she needs a wholly different way of hearing. But to take her from the first fit to the prescriptive match with 4 generational old hearing aids, this still is going to occur. There are still people who are going to need to use older tech. And we still have to be doing everything right by them too in order to get them there. Because now she went from literally not hearing to feeling like she's hearing everything in noisy spaces, in restaurants, in her church. everything. So it still does matter. You're still preaching.
Everything's the delta, right? What's
Exactly.
the difference in perception of what you previously had, whether it was previous programming or previous tech level, to what you have now? And so sometimes just literally going with an old hearing aid, optimizing it the right way, you're like, this is the greatest thing ever. There's
happened.
no way it could get better than this, right? Because it's a matter of perspective for that individual. And then, of course, you end up a couple years later putting them in the newest of the new technology, also optimized, and like, this is even better than what I previously had.
Even sometimes I've noticed just the way that following best practices and having the time, I had an individual who swears up and down she doesn't hear any differently from being from first fit to prescriptive match, but her experience and her understanding of what it is we're doing, what we're accomplishing, and how we actually are explaining her hearing loss to her has made all of the difference for her, right? And this is a different patient entirely, but we went through a whole fitting sequence, went through all of the details, and her confidence in the fact that she's hearing the best she can possibly be made to hear is the difference for her too. So really every aspect of the best practices is so vital, because one small thing, one change in how you explain something can even make that big difference for somebody.
Yeah.
But I've had cases though where I've taken people from older technologies that have been optimized into newer technologies. Just had this the other day as well. Had an individual 2 weeks ago who I refit with new devices, happen to be the devices that we've just been praising here a lot, the Phonak Sphere devices. And he comes back in, he's like, I'm just not noticing much of an improvement over my old hearing aids. Like, I don't think I want to keep these. And he's in the middle of his new tech fitting because, again, we don't just fit people and first fit set them. We don't just take old settings, dump them into their new hearing aids and hope that they work well.
Or just have them use them for a week or something.
Yeah.
Right.
Like, just, you can't get the full.
Exactly. You got to compare apples to apples, which means you're optimizing the new tech just the same way you optimize the older tech, because they have to be able to say for sure that the cost is worth it to be able to stay in these new hearing aids. Not everybody's independently wealthy and they're just like, just give me the new ones whenever they come out.
Exactly.
Even if it's 1% better, I'm still going to do it. Like, people need to see a significant improvement to justify the cost of changing tech. And I think it's shortchanging people if you don't put them through an optimization sequence with new tech, because then they don't really know if they're getting their full amount of benefit. And if they are getting enough benefit on just like first fit settings to want to justify switching, does that mean that they're only getting 20% additional improvement when they could be getting 80% additional improvement? So you really I don't like this idea of trial where it's like, oh, just take them for a day or two and let me know how it goes. It's like, no, like, you have to follow the best practices in order to optimize so you can actually get a good comparison between the two. But, I attempted to make some additional adjustments on this individual. I personally don't know if the adjustments that I'm going to make are going to have any significant improvement. He's rating at about a 10% improvement right now. Unless we get to about 30 or 40% improvement, even though he likes the other features like the tap control and the connecting up to multiple Bluetooth devices, all of that's fun. But we're really going for optimal hearing, and particularly in background noise. And as of right now, we're just not getting it with this individual.
But that brings up an interesting point too of, if you're not getting the amount of change that you would like to in that generation, there's an argument to be made, hold out. Because we, like I said, we normally get, a big change, then we get several smaller changes. Maybe that next smaller change is the thing that's going to make that 10% difference to the 30% difference, right? And so then there's an argument to be made of, us even as the provider saying, let's hold off for one more year. Let's not do this investment right now, because we know it could be worth it, but let's hold out one more year. Let's see what else they do this next generation. And then not only have you solidified their trust in you that you're always going to have their best interest, but then too, they might actually get that additional 30% that they're looking for one more generation out, right? So there's an argument to be made for not just, recommending upgrading to recommend upgrade because there's this new thing. If they're not seeing that benefit, hold out a little bit.
Yeah, and not everyone's looking for the same stuff with upgrading. I mean, you have different people who are looking for different things. I've got patients who are waiting for MEMS speakers to come out on hearing aids. For those of you who are unfamiliar, MEMS speakers is a silicon solid-state speaker that has a better bandwidth and amount of gain that you can get at different frequencies. So for things like speech understanding and clarity and music appreciation and all of that, there's certain technologies that are probably a couple years away that just aren't here yet. And even if they're ready to upgrade now into new tech and would get benefit from new tech, for some people it just makes sense to push that down the road a little bit longer.
Especially if they are pleased with how they're hearing right now too, right? Like, and that's part of not only best practices, but person-centered care as well, right? Because the way that I see it, our job is to tell everybody all of the options. I am supposed to give you all of the information, and from there, you're supposed to tell us what you are and aren't willing to do with that information, right? So if that's the thing that you're holding out for, now if you are having a terrible hearing experience, and I know for a fact, where that's a different, level of recommendation or a different emphasis that I would put on said recommendation. But at the end of the day, if that is not your desire, if that's not what you need, and if that's the thing that you have to hold out for, it's my job to help you kick that can down the road, make you hear as best as we can possibly make you hear until that point in time. Now, if we get 3, 4, 5 years down the road and we're still not seeing it, and now your hearing aids are kaput and we need to do something, again, different conversation, but that's part of that person-centered care for me to also not only know from the professional side, but to hear you as my patient and take what you need into account as well.
Totally. I actually had a patient who was kind of in that boat where she actually had 2 pairs of Oticon Open S1 hearing aids. So from back in 2017, 2018 timeframe. And she actually split her time between her 2 pairs, and it's because she had an insurance with her workplace at the time where they would give her new hearing aids every year. So she's like, okay, I'm about to retire. I want to get another pair of hearing aids exactly the same, and then she can extend the life of them because she's only wearing them literally 50% of the time, of the normal wear time. And I had tried to encourage her once the Moors came out, and then again once the Reals came out from Oticon, that I'm like, listen, these hearing aids are substantially better than the ones that you currently have. Even if you can only get 1 pair of them, that 1 pair will perform better than both of your other pairs combined, for lack of a better way to explain that. And she just held out. She's like, I just don't think that the tech has what I want yet. Like, let's just see if we can push it out a little bit longer. And then we had the Oticon Intense come out, and those were significantly better than even the Reals that were a generation before them. And she's like, okay, I'm finally ready. I'm gonna take the plunge, switch into these devices. And they were substantially better than what her Oticon Open S1 hearing aids were. Like night and day. Here's the thing, the Reals would have also been night and day better than what she had, but she's like, I just want to see what the next generation comes out with, and that next generation was better, fully encased hearing aids, or smaller hearing aids, all things that she wanted, and she's like, it's got the deep neural network, it's got the ability to hit the high frequencies better, I've got a high frequency hearing loss. We switched her, she could not be more happy than what she is with those hearing aids.
Does she wear them more often too?
No, she actually wore the other ones all the time. She literally would go 3 months, she would wear her 1 set of Oticon Open S1s.
I think I saw her for a follow-up.
She would go and wear her 2nd set of Open S1s for the next 3 months, so she could, instead of having to come in every 3 months for maintenance, which she needs, she could go 6 months without maintenance.
Smart.
Yeah, and so now it's a question of, well, she may have to come in for maintenance more often, but we really try to get people to do more stuff on their own. Some people are more resistant to doing maintenance than others. It's much better, and it can save you money if you're willing to do the maintenance on your own to some degree, and then have us do mid-year checks on it and do everything else that they're not able to do. But I think it doesn't really matter what brand of hearing aids that you have. Upgrading can make a heck of a lot of sense if the new tech has the things that you want it to do, or if your hearing aids are so old that you're spending all this money in repairs, it makes sense to upgrade at that point. But the fact of the matter still remains, if you're going to go and try out new technology, you don't just go and have it quick fit to you and see if you're getting an improvement there. You have to go and make sure that they're following all the best practices, and it might actually cost you a little bit more money to spend with the provider so they can optimize for you. Because you're going to be spending thousands of dollars on these new hearing aids anyway. You might as well spend an extra couple $100 to make sure that they're set up the right way so you can compare apples to apples from your old tech.
Exactly.
There you go.
Jinx.
Exactly. You thought you weren't going to do it during this podcast.
I
and
know.
Here you go.
So-
They literally did this right before we jumped on the show. You guys said something at the exact same time.
We just spend too much time together.
Yeah,
Is
you
really
guys,
what it boils
you guys
down
need to
to.
take a break.
Yeah.
Yeah, absolutely. Well, anyway, very good discussion. Thank you so much for that. Guys, if you enjoyed this, make sure that you hit the like button. If you are not yet subscribed to the channel with notifications turned on, go ahead and do that as well. And as always, we'll see you next time.